Hello, good afternoon, everyone from Geneva, Switzerland. My name is Alexandra Kuzmanovic, and it's a great pleasure to be here again with Mike and Maria, who are dedicating their time to answer your questions about COVID-19. If you have your questions, as usual, if you're watching us on Twitter, please use hashtag AskWHO. If you're watching us on Facebook, LinkedIn, or YouTube, leave your questions via comment section. Good afternoon, Mike, Maria. I'm glad to see you finally again virtually. Next week, hopefully, it will be in person again. And while we're waiting our viewers to ask their questions, maybe you can share your views on the epidemiological situation at the moment, as we have, after several weeks in a row in decline, we are seeing again increase in cases around the world.
Yes, so hi Alex, it's good to see you online, and we look forward to seeing you again in person, so welcome back. Yes, I think, we're looking at the global situation quite closely. We've been looking at a downward trend in incidence over the last 5-6 weeks, which is really, really encouraging, and it's telling us that the measures that are in place, the individual level measures, these public health and social measures that we've talked about, the measures that are in place to actively find cases and carry out contact tracing, good clinical care, all of this is working to actually drive transmission down and suppress transmission. We have in the last week, however, seen an increase in cases again. And this has been noticed and identified and reported in a number of countries. And this is really quite concerning. And the reason that it's concerning is because the world right now is quite fatigued with this pandemic. And, with seeing 5-6 weeks of really positive negative trends, positive declines in incidence, to see an uptick again, is quite worrisome. So there may be a number of factors that are responsible for this, but we're really looking into it. We don't have anything specific for each country, but what we are worried about, I could tell you what we're worried about is with the introduction of vaccines and vaccination in a number of countries, we still need people to carry out their individual level measures. We still need people to carry out physical distancing, working from home if they're asked to work from home, wearing of a mask, making sure you have good, clean hands, especially when you're putting on your mask, you're adjusting your mask, taking off your mask, making sure that you clean your mask regularly or you dispose of your mask properly if it's a single-use mask, that you have good ventilation in the spaces that you are in, you open your window, you avoid crowded spaces, you're following the local guidance. It's really important that everyone out there still adheres to these measures in place because we have quite a ways to go to continue to drive transmission down. It's going to take some time for vaccines and vaccinations to reach all of us, to reach most of us. And while vaccines are being rolled out in many countries around the world, we need to still continue to stay the course and adhere to these measures. Because if we allow this virus to spread, it will. If we increase our social mixing, if we increase our exposure to the virus, it will take advantage of that and it will increase. And so that's what we're worried about by seeing this 1 week of increase in trends. It's a pretty stern warning to all of us that we need to stay the course and we need to keep adhering to these measures at hand. And I think that's one of the key messages we want to reiterate today to everyone out there. We know you're tired. We know you want this to be over. But we have a role to play, and we need to keep, doing every single thing that we can to protect ourselves and our loved ones.
Thank you, Maria. Mike, what are your views on this increase and change in declining trend?
No more than, when cases are increasing, we say to everyone, it's are decreasing. It's never everything we do, and when they're increasing, it's never all our fault. So we just need to be, I think, at this point, be very calm and recognize the things that Maria has said. The virus is continuing to adapt. We may be relaxing a little, before we've got the full impact of vaccination. And I know everyone is just so tired of this and so exhausted and fatigued, and the sacrifices that people have made in their social and economic lives, kids not being in school, that there's a tremendous desire to get back to something that looks like a more normal existence for us all. The problem is every time we've done that before, the virus has exploited that. And the number of cases has risen rapidly, then the hospitalizations rise, and then the deaths rise. In this case, as we roll out vaccines, we hope we can avoid the worst impacts in terms of hospitalizations and death. But we're not there yet. 265 million doses of vaccine have been administered. But remember, 80% of those doses have been administered in just 10 countries so far. Just 10 countries. We have 9 different vaccines on 3 different platforms. We've had a huge success in the science and the ramp up of the production of vaccines. And campaigns have started in 115 different economies, so that's good. But many countries are well behind in terms of their ability to get vaccines into country and to get vaccines out to people. So we're still playing catch up on vaccines. So now is not the time to relax on our individual behaviours. It is not the time to relax on community measures. And if we are to do that too early, we risk that 4th surge or 3rd surge or wherever you are in your country, whatever the next wave will be, we risk driving that next wave of cases. And we just do not want to be premature. And we need to follow through on what we've all committed to do individually, as communities, as governments. And we need to accelerate as quickly as we can to get doses out. Great news this week was COVAX started delivering vaccines under the COVAX initiative. I think now 10 countries have received the vaccines. It's nearly 10 million doses have been delivered. That's a huge step forward in terms of at least beginning the journey towards better vaccine equity around the world. So we should celebrate too, even if we are suffering a bit of a plateau on a rise in cases. And that rise in cases is pretty much consistent. It's nearly affecting every WHO region. I think we've seen Eastern Med 5 out of the 6, 4 out of the 6. Yeah. So this isn't just an isolated phenomenon. This is happening pretty much all over the world. So we need to also think about, if we do get this disease down to lower numbers, and we've seen those numbers drop in countries, what are we going to do then? We're vaccinating our most vulnerable. We're vaccinating our frontline workers, I hope, and we can get equity in that process. That will give governments more policy options around how to open up society. Because if the consequence of opening is not immediate hospitalizations and death and tragedy, then governments have more options. But we shouldn't be working to dates. There is no date. The virus doesn't understand dates. What we understand is the number of cases and the number of new cases every day. We should be looking to get that number as low as possible. We should be looking to get the number of hospitalizations as low as possible. So we do have to continue, and I think for a significant period of time, our own individual behaviours, be it washing hands, be it avoiding crowded spaces, wearing masks, making sure if you're indoors that you're in a well-ventilated space with as few people as possible. These are things we are going to have to continue. This is not going to stop anytime soon. I think what we would all like to get rid of is the imposed measures where governments have had very little choice but to impose stay-at-home orders and lockdowns and close schools. The things that have really, is wearing a mask or maintaining some physical distance or washing your hands or avoiding very crowded spaces, is that really what's driving us all nuts? Or is it the fact that our kids can't go to school? And that we find it hard, we can't use public transport, or we can't travel more than X number of kilometres from our homes. The measures that, in a sense, governments have had to impose to suppress virus transmission, I think that's what we need to think about. How do we get rid of those big societal measures that are shutting down society? And the only way we get there is to get the number of cases as low as possible. And that's going to require continued individual behaviour. It's going to require, when the numbers get low enough, strong public health surveillance, contact tracing. I'm saying this for 14 months now. I feel like a broken record. And then linking that to vaccine. If we put those 3 things together, if we put continued individual behaviour, to protect ourselves and others, if we put that with strong public health surveillance and contact tracing and those other measures we've spoken about, and we add into that vaccination, if those three parts of the equation work, then those big shutdowns and lockdowns can become a thing of the past. If we fail in either of those three things, if we fail in our individual measures, if we fail in public health systems being able to pick up again with contact tracing and quarantine and isolation, or if we fail in delivering vaccines in an equitable fashion to all countries in the world, if we fail in either of those three, I don't see any other options that we will end up drifting back towards large-scale societal measures, because the surges will come and governments will have no option. So to some extent, this is in our own hands. And I really understand how just exhausted and fed up everyone is. But right now, we're getting close. We see light at the end of the tunnel. Vaccination is beginning to roll out. So let's stay the course. And I know how easy that is to say and how hard that is for each and every one of us, including myself, to deliver on.
Thank you, Mike. Maria, you wanted to share as well some concrete trends on decreases and increases in cases around the world, right?
Yeah. So, I mean, when we think about this, I mean, I know we've been seeing these positive signs of reduced transmission, but it's not over. And then the last week, as I'm talking to you, I'm looking at the latest SITREP that we published yesterday on this, where we give weekly trends by region. And in the last week globally, we've had more than 2.6 million cases reported to WHO. That's a lot of cases being reported still. It's certainly a decline from the peak that we were at, where we had more than 5 million cases reported per week. But that's still a lot of people that are getting infected. So this is still a significant threat around the world. And that's a 7% increase from last week. And so we really do need to watch what we're doing. It varies by region, and of course within region there's a lot of differences by country, and of course even within country, the virus spreads unevenly. In the Americas, in our WHO region of the Americas, in PAHO, we've had a 6% increase in the last week. In our European region, we've had a 9% increase in the last week. In our Southeast Asian region, we've had a 9% increase. In the Eastern Mediterranean region, we've had a 14% increase. In our African region, we've had a 24% decrease. And in the Western Pacific, we've had a 2% decrease. So it varies by region, and it varies by country. If we look at deaths, reported deaths in the last 7 days, that is still declining. And I think it's the third week where we've seen a decline in the number of reported deaths. Now, this is really a good sign, that we are starting to see a decline. But in the last week, we've had more than 63,000 people die from COVID-19 that we know of. So this is a significant burden on all of us, and everyone who is out there who is lost, who's had somebody that's been infected, who has had a friend or a family member who's lost someone. These individuals cannot be replaced, and we mourn with you the loss of your loved ones. And this is far from over. We have tired health workers who are doing their best to provide care. As we are able to reduce case numbers, we reduce burden in hospitalizations, which gives health workers a chance, to catch their breath in terms of caring for patients and have a little bit of recovery time on their own. But many hospitals are still dealing with large numbers of patients. So we are trying to balance our messaging with being hopeful, with the fact that public health and social measures work, including against the virus variants that are circulating. We are hopeful with vaccines and vaccinations rolling out, but make no mistake, this virus is still circulating, and it has a lot of energy to spread, as Mike has said several times. And if we allow it, it will spread, and it will continue to put people in hospital, and it will continue to kill people. So, it's a rally call. Let's continue to drive transmission down. Let's get it down as low as possible while we roll out these vaccines.
Thank you, Maria. There are a few follow-up questions, in particular to your answer, Mike. You mentioned that 115 economies have started the vaccination against COVID-19, and our LinkedIn viewer is asking, are we working fast enough to immunize the whole world population.